Let's begin this hour, though, with news out of Moderna. Moderna boosting its manufacturing capacity for its COVID-19 vaccine. The drug maker announcing today it is doubling its investment commitment for 2022 with plans to manufacture up to 3 billion doses. Let's bring in the CEO of Moderna, Stefan Bancel, joining us today, alongside Yahoo Finance's Anjali Kamlani. Stefan, it's always good to have you on the show. Walk me through this build out right now. What exactly does this new commitment entail, and what does it mean potentially for what we're likely to see in terms of commitments next year this year, 2021?
Yes, so thank you for having me back. If you think about what has happened over the last month or two, is one, let's talk about the science. We are seeing more and more variants of concern. As you know, right now in South America, the P1 variant is causing a lot of hospitalization and death, despite many people being infected naturally last year with the ancestral strain. I don't have to talk to you about India. You guys are all following closely India. It's unfortunately getting worse and worse by the day. We do not know yet about this B617 variant, how bad it is with double mutation. And so that's kind of a background, which is we don't think we are done with this virus. I worry deeply about the next 6 months because in the southern hemisphere, you have more people than in the north. You have more density in houses. And as we're getting into their fall and their winter, you're going to see more infections. And then you have also a lot of people that are HIV positive. That is also a good ground for the virus to mutate. And so we believe the virus will continue to mutate and new variants will be problematic. The other piece, too, is what has happened in the marketplace. We are hearing from governments that are calling literally every day that what they want for the future, especially for 22, because the orders for 2021 are already fully booked, is they want high-efficacy vaccine. They want a vaccine that is well-tolerated from safety profile, that can scale manufacturing-wise, and can go very fast to keep chasing the variants. And that's what actually mRNA vaccines do. And so based on that feedback, we decided with our board to go into making multi-billion-dollar investments to get to the world up to 3 billion doses of our Moderna variant vaccine for next year.
Stefan, Anjali here, I know that we're going to discuss those variants in just a second. But before that, on that point of production, you've already said in October that you're willing to not enforce certain patents and willing to license your IP. And so I wonder, has that been picked up yet to the point of being able to scale it up, specifically in companies in India or elsewhere? And is that part of the discussions you recently had with the World Trade Organization?
So we've had a lot of discussions over the last 30 to 60 days as this context around the variant has deteriorated, as governments have been calling on how do we get the maximum output. That's what we care the most about, to help as many people as we can. And because we have still a small company, Moderna is 1,300 people, is the tech transfer will take resources away this year to prepare for next year if we were to outsource the technology. That will limit our ability to make as many vaccines as we can this year. This year we announced this morning we are raising our base plan. It was before 700 million doses. We're upping that to 800 million doses. The team is still working as hard as we can to get to 1 billion doses for this year. And so the reason we decided to go with our own capital, with our existing partners, is that limits the number of tech transfer we have to do. That then increase the execution for 21 and for 22 so that we can maximize how many doses we get for the world.
So then on the variant side, I know that that's something you also have to focus on, and you're looking at the potential to develop variant-specific boosters as well as lower dose boosters. You've said in the past that we could see those by fall of this year, but recently one health expert, that's the Dean of Brown University School of Health, said that it's unlikely we'll need boosters in 2021. Do you think that that's true? Or are you looking at mostly next year?
So I think we're going to need boosters starting this fall. And there are a few reasons I believe that. One is there is a body of work, including done by Professor Davenport in Australia, that has been published, that shows that the immunity is waning over time. It's still high, but it's going down. Point number one. Point number two is the variant, which is, I think, your chance of being sick if you got vaccinated in December 2020 or January 21, next fall is pretty high if you get infected by a variant, not the ancestral strain for which the vaccine was designed. So I think it's a question of risk tolerance. Do I think it's a good idea to go through the fall with people at the highest risk vaccinated in December of last year and in Q1, the 65 and above, not being boosted in the fall? I would not want to make such a decision. I think they should be boosted.
So mostly for that 65 and up. Okay. And then when we're talking about the ability to, look at that production and the sort of the reputation that mRNA is gaining and the future outlook of that, on one hand, there's a lot of really good data right now on the durability, on the safety profile. And you've also talked about how mRNA remains 90% plus effective, after 6 months, and sort of to the detriment of adenovirus vector vaccines. You declined to join J&J on that front to talk about blood clots, even though mRNA does also have some rare risk of side events, as well as talking about that efficacy rate, contradicting some health experts who have said just take any vaccine. So why are you choosing that strategy to sort of separate yourself?
We follow the data. We are a science-based company. We have brought over the last 10 years a new technology to the market that for many, many years people believe will never work. And we kept at it because we believe if we could find a way to safely launch a product, it will change medicine forever. Because as we discussed before on your show, mRNA is an information molecule. It made no sense that this will be a one-drug company. It will be zero because we go bankrupt before we get a product launch and we cannot figure the science, or it's going to be a lot. And so we follow the data. I believe that waning immunity is happening. You can see it already in Latin America and India. I believe last year, many people in the South got infected already. And when you look at the hospitalization right now, the severity of the disease, the decrease in age, those variants are becoming more difficult. And the waning immunity, I just talked about it. Professor Davenport ran a very good model that he validated recently with new vaccine. And I believe that if you can get a 95% efficacy vaccine versus a 60% efficacy vaccine, you should do so because that's the best way to protect you, because your antibodies are going to go down over time. And while, Angeli, you are a young person, you might be fine even if you get a variant in 6 months or 9 months. But I believe a 65-year-old or 70-year-old who has comorbidity factors, we should protect them. If we don't act aggressively to protect them, what will happen? More cases. In the US, the thing I worry the most about is vaccine hesitancy. If you look at the data from this morning on the CDC website, 82% of 65 and above have been vaccinated. But if you look at the last few weeks, that number has totally plateaued. It's going up super, super slowly now. So what happened in the fall when the young children have not been vaccinated yet because no vaccine is authorized? You still have around, 20, 30%, 15%, I don't know, of people that have no vaccination. And you have those variants coming back from the southern hemisphere into the northern hemisphere. I think we need to protect our elderly and people at risk, or we take a very high probability to go into the next fall and winter that might be as bad or worse than what we saw last year. Look what's happening in India now. They thought they were done with the virus. They were not.
Yeah, and Stéphane, last time you came on here, you said you think that this might be with us forever, that we might need boosters on a rolling basis. And I wonder, as you're talking about kind of vaccines plateauing, what that might look like if you suggest boosters all the time for Americans out there, because as you said, it gets trickier and trickier because people might not think they need that booster. So how do you see maybe what's going to need to change to maybe get those out in the future and really get people on board with the idea that boosters are going to be good for them if you say the risks are still quite high that they would be reinfected?
So a few things. First, again, the data. I believe that as the data continues to emerge, the scientific community will more and more realize that we need to keep boosting people, especially people at high risk. Unfortunately, I think the places we won't do so will see reinfection rate, and people are going to hard, unfortunately, the hard way, which is very sad. And I also think that, as we discussed before, we're going to get a high efficacy seasonal flu vaccine on the market. And our goal is to combine the COVID boost with the seasonal flu. So our vision is that in a couple of years, you will be able to go to your GP or to your CVS store and get a single shot, giving you a high efficacy flu for the winter, a high efficacy COVID boost, and you will have a nice and happy winter. And I think people will just get used to it. I think companies will be helping. I think CEOs that I talk to are very, very concerned about the next few years. And if you propose them a solution that allows you to be rather safe than sorry, I think they'll take it.
Stéphane Bancel, always setting the expectations for us moving forward. Moderna CEO, it's good to talk to you today. And our thanks to Angelique Kamlani as well.